the March of Dimes. Congenital heart defects are the #1 birth defect in the U.S.
1 in 100 babies have it, and it can be deadly. We're talking about congenital heart defects.
Congenital heart defects are the most common type of birth defect.
About 1 in 100 babies are born with a congenital heart defect. About 1,700 die from the disease each year.
I have transposition of the great arteries.
I have an intramural coronary artery disease.
Pulmonary stenosis.
Being born with congenital heart disease is a challenge right from the start. It's a challenge from day one for many of our patients. It can be a challenge in utero, and sometimes the care of a patient with congenital heart disease starts even before they're born. They're faced with surgeries during childhood, they're spending their time in a hospital, they're feeling alone, they're feeling like they don't have support. And you know what? That doesn't end.
I was born with double outlet right ventricle.
Aortic valvular stenosis.
Transposition of the great vessels.
Tetralogy of Fallot.
I think the hardest part is not knowing what's going to happen to you and not knowing the effects that it's going to have on you in the long run.
It's just pain. Sometimes it hurts.
The hardest part is knowing that you're not like other kids.
The hardest part of growing up with congenital heart disease was feeling alone. When I was little, I would fall asleep sitting up because I was afraid if I lay down, I would never wake up.
It was probably having adults treat me differently than the other kids around me.
Transition means a change or?
Probably, I don't know what transition means.
Two Heart's main mission is to help kids and families with the transition process. And there's a lot of good evidence that within congenital heart disease, that transition is a big issue, with a lot of patients falling out of care and therefore getting worse, more physical complications and ultimately probably dying a lot sooner than needed. Hence, Two Hearts plays a vital role in making that link from pediatric to adult care.
Responsible transition is so important because most of our young adults who have congenital heart disease, even though they may have thought they were cured, very few of them are cured as a child, and many can present with complications later in life, such as heart rhythm problems, valves that fail over time that could lead to dangerous heart rhythms, or heart failure.
When I went off on my own for the first time when I was in college, I didn't know anything about my condition other than what I knew was tetralogy of Fallot. Other than that, I had no idea.
I wish I would have known more growing up.
I don't want her to be self-conscious about it. It worries me that she's gonna feel different and just not like all the other kids her age.
If you go into this transition process not really understanding what to expect, you have this kind of layer of uncertainty that clouds every experience that you may have. And so not having the tool set to make that transition can be a very difficult thing to deal with. Not to mention you actually have to make the transition. And so I think that these kids need to have the knowledge of what's important going forward. They need to understand what their diagnosis is, what their surgeries or interventions have been. They should really have a sense of not only what their heart looks like, but who they are and what their story is.
I think it's important to educate children about their conditions and about the transition into having an adult condition, mainly because it's empowering to know who you are.
I'd love to see her go to college. I'd like to see her continue gymnastics. Just to see her live her life completely would be great.